Well, I was laying out on the picnic table in a bikini, and Dad was in the yard. Gary pulls up in his driveway, and he said, "Gary, this is Barbara. Barbara, this is Gary. Get together."
How could you resist? If you pull in your driveway and you look next door and see somebody real pretty.
3 sons, 8 grandkids, and 5 great-grandkids.
I worked on B-52 bombers and F-105s, and I got to take the veterans and the older guys, and anytime you can help an older person that's been in the military and everything, that's good.
Of all the things in our life that we've done, I have to say that taking those flights for those veterans to Washington has got to be the most fulfilling thing that we have ever done. He's been a wonderful father, husband, he's a family man. I bet you in 56 years, until he had his heart attack and had to quit work, I bet he didn't miss work 5 times. He was having abdominal pain, shortness of breath. We were thinking maybe it was more heart-related. But when we got there and we found out that it was his kidneys, at one visit she came back and she told me, "I do not think his quality of life will be very good with all his health problems." And she said, "I think we're better off to sustain him the way we're doing." And it's nice to be able to have someone to do that, come in and check and see that everything's being maintained the best that we can maintain it.
I'm not a hospital person. I don't like hospitals.
The palliative allows a little bit higher level of care. He gets nurse practitioner visits, and it reduces him having to go to the doctor all the time and going to the hospital, which that's just difficult on anyone. And so the palliative option allows them to have that care in the home, to treat those symptoms and give him best quality of life. For me, a goal for him was, making the best food choices to support his kidneys and give him better quality of life, but also for them to understand where his blood pressure is, where his pain is, what his limits are.
When you can pick up the phone and call someone and say, "Hey, this is going on. Do I need to worry about this?" We always discuss his medicines and how he's doing, and she checks him and his, blood pressure and all that kind of stuff. And she can visually see how he's doing.
Most days it's just seeing people and talking to them and, if they have enough food or, if they can pay their rent, their utilities, can they get to their appointments?
The boys are always there for us. They help us. They help me shop. They help me take care of things that he used to could do and can no longer do, But the medical part of it, I needed more help. Someone to explain things to me, someone I could call other than panicking and making a run to the hospital.
She has called me before, outside of hours, with elevated blood pressures or concerns, and we've talked through that and reassured her she's doing exactly what she needs to do. The pharmacy will call the doctor and have a peer-to-peer conversation, saying this is what the member is experiencing, or could we possibly look at this alternative? And those changes you see in their lab values getting better and the way they feel getting better.
It's really been effortless, because we're all working together. Palliative Care's working with us to keep him in his home where he wants to be, surrounded by his grandchildren, his great-grandchildren, because he truly loves that.
He's a good old guy. I'm going to try to keep him another 56. So.